name is John KANE. I've been at the Zucker Hillside Hospital for many years and serving as its chairman of psychiatry. It's really a unique facility dedicated to advancing the science and practice of behavioral health care. The Zucker Hillside Hospital was founded in 1927, and it is one of the largest psychiatric hospitals in the region. It's now part of a very large and forward-thinking health system, the North Shore Long Island Jewish Health System. So the mission of the hospital is really to advance the science and practice of behavioral health care. We know that there are many people who are not receiving the care that they need. We're trying to combine technology, consumerism, new evidence to be able to advance the care of all of the patients that we treat.
So I'm investigating neurodevelopment in adolescents who have schizophrenia or bipolar disorder compared to healthy controls. And the reason why that's interesting is because your brain keeps changing up through adolescence and into early adulthood. And that's also the time that people have the onset of schizophrenia and bipolar disorder. So what I want to know is whether there's something different about the way the brains of patients are growing compared to how controls are growing, and if that might tell us something about why people are getting these disorders. It's great to be at Zucker Hillside Hospital because there are a large number of resources for new investigators trying to develop independent research programs. And in addition to that, there's a lot of interaction between the clinical end of things and the research end of things that can really help us develop the best treatments to help patients as quickly as possible.
The major goal of our research program is to enhance the outcomes of patients who suffer from major psychiatric disorders like schizophrenia, bipolar disorder, and depression. And we hope to use the modern tools of neuroscience, molecular genetics, brain imaging, psychophysiology to help understand the pathophysiology of these disorders and to help to understand what's the best treatments for patients that suffer from these disorders. A major goal of ours is really to train the next generation of researchers. We feel that for research to really go on, not just for us current researchers to work in the field, but to really have a new generation of new minds, young investigators.
I'm Deepak Sarpal. I'm currently a chief resident of psychiatry here at the Zucker Hillside Hospital. I'm in my last year of training and I'm balancing my clinical training with research. I found a good balance between the two and was able to ask questions within my own patients and then take those questions to the lab. And I would have support at either end. My supervisors on the units would support my research and the researchers supported me asking these questions. The goal of this work is to refine our clinical algorithms so that depending on some biological marker within a patient, we can say they should be on this treatment or that treatment. And that really kind of eliminates the guesswork that's involved in psychiatry and it personalizes the approach to treatment.
So we are a general adult psychiatry training program. We have 12 residents per year, a total size of 48 residents. And really our vision, our mission is to train, create outstanding clinicians and emerging leaders. This training program is unique in a number of ways. One is it occurs primarily here at the Zucker Hillside Hospital, which is an incredibly, it just has everything here on one campus. You've got 220 plus bed inpatient, you have partial and intensive outpatient programs, you have all these different ambulatory clinics and specialty clinics, bipolar, college-aged students, early treatment program. We have one of the largest ECT services in the country. So our residents get to follow patients across these different settings and get to participate in these clinical services, which are highly informed by the research that's happening here. So they're able to both learn and participate in the cutting edge, leading novel treatments for these disorders, as well as to help develop that new research and new knowledge.
We're very proud of the impact that our research has had in helping to inform clinical practice, whether it's providing the right treatment at the right time for someone with first episode psychosis, or finding the right medicine that can help someone who hasn't responded to other drugs. So on a day-to-day basis, the research that we've done is having an impact on clinical practice across the country and around the world.